was to give this talk towards the end, and what I wanted to do was talk about advances in spine surgery as it relates to both navigation and robots, and tell you about some of the projects that people are working on here in the United States, and how we're integrating all these new technologies and what it's leading to. And there's obviously tremendous improvements going on with both the navigation as well as the robots, and it's really exciting to see how spine surgery has evolved very significantly because of both these navigations and because of these technologies. And as Shailesh has mentioned early on, that my focus currently is on awake spinal fusion, which is of course a minimally invasive approach to doing outpatient spinal fusions. But I bring up this point because I want to always emphasize it's important to understand what the goal is. What are we trying to achieve? We can get really caught up on talking about the benefits of this technology and that technology, but I think ultimately at the end, if the patient is in the middle, it's important to remember that still spine surgery needs to be made safer. It certainly needs to be made more cost effective. And then ultimately, it's got to be a good experience. All of us believe in the benefit of spine surgery, but I think it's important to always remember what the goal is. Because in the United States and in India as well, the population is aging, right? And as it is clear that there's going to be a greater demand for spine surgery overall. Now, if there's going to be more people getting spine surgery, we have to be sensitive to the cost of spine surgery. And I think that that's something that I'm a little bit worried about as we introduce new technology. If the new technology is raising the costs but not improving the quality, I'm not sure if that's a good direction to go. But then ultimately, it's also important to remember that the goal is to get a good outcome. And I think there's still tremendous variability in outcomes. And there are a lot of reasons why there's variability in outcomes, but I think it all starts with the proper diagnosis. And that if you have the incorrect diagnosis, it doesn't make a difference what technology you use, you're going to have the wrong surgical procedure. And so the question is, what are some of the issues that right now that we're dealing with? Of course, there's still tremendous medical issues involved in doing spine surgery. And of course, there are issues involved with just surgery itself. And a lot of the focus of this presentation is regarding instrumentation. But again, I want to incorporate all this because it's going to be relevant to what I speak about in a few minutes, which is that we have to really, really be careful that we correctly identify who needs the spine surgery and get them in to see the specialists as much as possible. And I think what's so exciting to me is that as we integrate navigation and robots, these new advances, we're going to be able to use data, big data, machine learning, and that ultimately is going to help drive outcomes, which I think it's important to remember that this is the goal. So in terms of advances in spine surgery, at the very immediate stage right now, the focus for the companies that are involved in robots is most importantly, the precise placement of instrumentation. And then ultimately the goal is going to be able to put in a pediatric cervical pedicle screw with minimal complication. That is going to be the gold standard that we have to sort of aim towards. And as we become better with instrumentation, there's a lot of work being done now on using the robots to just begin doing proper decompressions. Right now, a lot of the focus is in the tumor world, but ultimately there's no reason why a robot can't be involved in just doing a simple laminectomy. There's been some focus, Globus in particular has been looking at this role of the robot doing a TLIF, and what they're looking at is how can they get the robot to do an accurate facetectomy and discectomy with proper imaging so that you can insert a cage. And there's a lot of focus and research being performed at that level. And then ultimately, once you get the decompression aspect of it down and the haptics of navigation and robots become better, then you'll start being able to do more accurate osteotomies. So beyond just instrumentation, this is where sort of the next generation of companies are looking at with robots. But I think what's interesting is sort of what is the future now? What is going on, and where is there a lot of collaboration going on? What's nice is that we have incredible companies like Johnson & Johnson, which is working with Google, and you have companies like Da Vinci, which has been working on their robot for a while, and they're starting to partner with Microsoft. And what's going to be interesting to see is what these collaborations lead to. At a very high level, there's three things that they're working on in terms of the future. One is the development of independent workstations for spine surgery. Two is the ability to perform robotic surgery virtually. And then three is this notion of remote proctoring. So we know that, for example, with the Da Vinci at this point now, with prostate surgery, kidney surgery, the surgeon doesn't need to scrub in. And the accuracy of those kind of surgical procedures is very high. So there's a lot of focus right now on in spine surgery, ultimately moving away from the surgeon having to scrub in. Because once we get to this point, and it's not too far away, what's going to be nice is the ability to do surgery virtually. During the COVID pandemic in the United States, and I'm sure in India, telehealth and remote care has just exponentially increased. And so, beyond just being able to give diagnosis clinically, there's a lot of focus right now on doing remote surgery. This is a company called Corindus. About 2 years ago now, they did telerobotic surgery for vascular procedures. This is a patient who was having a vascular procedure. The doctor was in Massachusetts, and the surgery was being performed in San Francisco. I think it was about 28 patients. And they did something similar in New York as well. And they compared the outcomes clinically from an independent doctor. And they found that the outcomes in both San Francisco and New York were equivalent. So they showed from a proof of concept perspective that telerobotic surgery can be done across the country. The bandwidth is very good, and there's no question that this can be done across the world as well. India is not too far away because India is already doing something like this. I believe Bharat in Ahmedabad is a cardiologist. You may know him. That there's a cardiologist who performed telerobotic surgery 32 kilometers away, and that worked out really well. But the notion is not new. In 2001, there was a surgeon there was a surgeon in New York who performed a laparoscopic cholecystectomy in a patient in France. That was 19 years ago. So what's interesting is that's something that Johnson and Johnson is working on very closely with Google, and the hope is that ultimately the surgeon anywhere in the world can perform surgery on a patient really anywhere in the world, and that's been a major focus now for the second generation of navigation and robotic technology. The one I'm also really excited about is this whole notion of proctoring. So there's a lot of surgical procedures. I'm always amazed at the surgical skills of surgeons in India, and I think that in the U.S. we would benefit from the greater collaboration. So I think a lot of times during surgery, when a surgeon is in a complicated part of the procedure, if they don't have a senior attending who they work with, they often have to work through it. And now there's a lot of work being done where another surgeon can view their surgery by using glasses or some type of video. And what can happen now is that surgeon from a remote location can walk that surgeon through and help them get them through that procedure, or perhaps even show them a short video. So there's a company called In Touch Health. They originally started with just typical telemedicine platforms, and now what they have set up now, and I forgot which company they're working with, but while you're doing surgery, they can have a video displayed of what surgical step you're on, and they can basically display on the top left-hand side, you can see a virtual image of how to get through it, so that if you're in a remote location and you don't have access to a senior surgeon, now they have the ability to sort of understand where you are in the procedure, perhaps play a video or pop open a virtual image, and that will help walk you through how to get through that procedure. So this is actually really exciting. This company is doing very well, and this technology will be coming out to the market fairly soon. And then finally, to my point about delivering good outcomes, ultimately there's going to be a need for integration of all these technologies, robots, navigation, telemedicine. There'll be a time now, and this is not too far away, where an MRI image will be uploaded to a computer, and the computer will understand that the patient has spinal stenosis at L4-5. The patient will upload their pain levels, and data will be able to be correlated to that patient, and then eventually the computer will be able to sort of look at the patient's profile, spit out what the patient needs, and then essentially instruct the robot with the assistance of a surgeon, hopefully, on what kind of procedure can be done. This is the focus right now between the J&J collaboration and Google. They call it a digital surgery program, where they're trying to basically have mechanisms to collect data off of imaging and patient symptoms, and have a computer sort of process this all together and determine what surgical treatment is going to lead to the best outcomes. And with AI and machine learning, this is not too far away. But I wanted to just give you a sense of the focus of where things are right now. So that was hopefully just a good overview for you. Hopefully this was helpful to just give you a sense of where the second generation work is being done now in this state, in this